All right. So this is how to foam roll your iliotibial band. This is a biggie. This is a huge factor in knee pain, hip pain, groin pain. Super important. Everyone is tender in their iliotibial band. So this is a great way to free it up. Before I show you how to do it with a foam roller though, I want to show you how to do it with your hands or potentially even a rolling pin. So this can be way too tender for people to tolerate. So if it is, start with your hands. Typically, I'll do it in a chair, or you can do it in this position where I'm at right now, and just taking your hand and digging it down your thigh. Just really dig down your thigh. Make it hurt. Look for the areas that hurt, all right? And try and rub those out. You can squeeze it, rub it like so. You could take a rolling pin like you'd use to make pies or chase robbers with, and take that rolling pin and just iron it out, going back and forth. Looking for the areas that hurt. The iliotibial band comes from your ilium up here down to your T tibia down here. It's right along the outside here. You might want to be a little bit more on the top. You can look underneath down in here as well. Not in your Duluth carpenter pants pockets, but more in the backside of your leg there. Just trying to find those areas to free up. To do it with the foam roller, this is definitely the most effective way to do this, but it is painful. But as you do this stuff regularly, it won't become painful. Your body starts to get used to it. Let's see here. Right about here. Okay. If I'm doing my right side, I'm going to take my left foot, I'm crossing over. Again, you want to make sure you have traction. My bare feet on this wood floor, I've got nice, good traction. I wouldn't do this in my socks because I'd be slipping too much. Or I could do it with my sneakers on or shoes on. So here, I like this to be done off your hands. Some people do it off the elbows, but in my opinion, it works a little bit better off your hands. So in this position, you're going to roll back and forth all the way from the hip down to the knee. Notice how periodically I have to reposition that left foot for control. Everyone, when they do this, they just start going like this. Really, you want to iron out the whole IT band or iliotibial band. Notice how I got a little bit forward into it. I'm a little bit more on the back side, and this hurts. Good. You're doing something. Typically, I have patients do this for about 2 minutes, 1 to 2 minutes. I had one patient once who went for 15 minutes. She gave herself a bruise. That's a little bit excessive. Don't go that long. But as you start to do this regularly, it'll hurt a whole lot less. As you get a little bit better, and as long as you're not getting bruised up, some people bruise easier than others, you can put your whole body weight through it, just looking for those areas. This can actually become a great core exercise. Now let's talk about that. To keep the lower back protected, when you do this stuff, don't hyperextend your lower back. Keep that core always a little bit tight, that pubic bone gently pulled up towards you. And that is how you foam roll the IT band.